In other words, we've not even concentrated on the issue, where the problem really is. Is that what you're saying?
We have not really concentrated in terms of providing services to those areas.
Yes.
Because it is an access issue. How do we access these services? If they are too far away, or if the doctors are gone after 5 o'clock, when the people who need the help, where are they going to go? Who do they see? So consequently, what we find here is the men, and especially African American men, are the last one to seek help.
Okay.
And where do they seek help? When they do, it is in the emergency rooms when they are very sick, and therefore when we look at the cost of treating them, healthcare cost, the highest, the most expensive person to treat, according to the data that we have,
is the black male.
Is the black male.
Yeah, that's right.
It is the black male.
And if we could deal with that, you think we could reduce the disparities that
we
we're
can
talking about?
Yes, but it will take a lot of education programs. We got to tell them where to go, who to see. We need to bring them into the healthcare system early on. The women get into the healthcare system early on. They talk to their physicians very easily, but it is the men who are the last one to go.
And these are the ones with the high cancer, cardiovascular disease, and stroke issues, and et cetera.
Yeah, they're all, yes. So we need to focus on those subgroups in order to get them in, if we are going to be really narrowing the disparities. Otherwise, we can keep on giving lip service to health disparity and do nothing about it.
But you're saying that education and access is the most
increasing
important
access
dealing with
are the
disparity.
two. Yes, yes,
and good.
There is no reason for us to find, as I have found, that the mortality rate is about 3 to 5 times for stroke only among younger African American between the ages of 35 through 55. This is the period when everybody is busy with their lives. Their children are growing. If you have a stroke
in the middle of,
in the middle of your productive period of one's life, how are you going to take care of the family? But if you don't know what your blood pressure is, that's an educational part. We need to cuff you up, find out what your blood pressure is, put you on medication, control that, because that is the culprit for many of these disorders that we are looking at, or many of those mortality rates that we are counting at.
Cardiovascular diseases, stroke.
Yes.
Now, you mentioned over the last couple of minutes that we have here, Doctor, you mentioned the prevalence of depression. Say something in reference to that, what your research has revealed.
They're about 14%, depending upon how you measure it. It's about 14% of the population which is depressed at any given time. Okay? Now, I will grant you that this is, I'm not talking about a major depression, but this is the depression which is impacting enough that one is not able to go to work and be productive in their lives. We're trying to handle that through counseling, through medication, all of that through, again, education. We're trying to see whether or not people realize their symptoms. Do they recognize the symptoms of depression? And if they do recognize, can they go to the right place to seek help? And that is very, very critical. Because once one of the outcomes of depressive symptoms is people withdraw from the society, from the social context. They don't want to go to see anybody. They don't want to talk to anybody. You know, they're always withdrawn completely. That's one of the problems. So we got to handle that, especially when we are looking at younger people on our campuses. We need to do some counseling programs there for our students.
And of course, Doctor, this is excellent information, but as you know, we've just about run out of time. But let me thank you for bringing that excellent information by, because I think that when we talk about these disparities, what you're telling us now is that we can map this out and we can determine why these disparities exist. And if we could deal with education and if we could deal with access, that we could go a long way in trying to reduce that. Is that what we're saying?
That's true.
Very
Absolutely.
Good. And I think that that's a good piece of education for us. And let me thank you for bringing that information. And let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.